Okay. Welcome everybody. Sorry we're a few minutes late getting started with our 6:45 start. Facebook switched up some of their settings on me, but I think we're all set and ready to roll with this. Good evening, everybody. This is Dr. Nicholas Morrow with the Disc Centers of America here in Fairfax, and tonight we're going to be talking about one of my favorite workshops. This one's titled Bulletproof Your Low Back. But tonight we're actually going to work in some current topics and events that are going on with the coronavirus, your immune system, social distancing, and I got some options and some alternatives for everybody to do your part, to play your role, but also to stay healthy and pain-free throughout this trying time that we're all going through right now. So our lives have changed in the last couple weeks, and they change from day to day as far as the information we're getting on the virus, on our pain levels, on what to do next, on what the symptoms are. And there's a lot of stress out there, and that affects your body's ability to grow, heal, and repair. And it's with that premise that I am so very excited to share tonight's information on keeping your back strong. And then as a special tip for this, we're going to do some coronavirus stuff, how to avoid it, some facts that's going on with the coronavirus, so that we can shed some truth on a lot of the fear mongering and poor information that's out there for everybody. So without a further ado, let's get started and see what we get to go over today. Make sure I'm on the right page here. Good. All right, so tonight we're going to be talking about low back pain. We train this for a lot of different reasons. One, with me being a disc center, I specialize in disc injuries, herniations, slip discs, and bulges, and this plays a big role into our patients that are under active treatments, our patients that are considering treatment, as well as the patients that have just finished up their treatment and are doing well and transitioning into maintaining their work. So what we're going to work on today is just all the information, the science, the truth behind the information, and talk about just how important your body's role, your immune system, the nervous system is in all of this. And so let's start with these body signals: the low back pain, the tight muscles, the lost range of motion, the stiffness, the leg pain, swelling, burning in the legs, numbness in the legs. We see these patients all the time, and these are some of the most common symptoms that we see. And this affects a lot of different demographics. This affects a lot of different types of people, from the contractor that's constantly lifting and working and using their body as a tool, to the busy mom that gets no rest time and is always running and doing and balancing and handles 100 things at once and still is trying to maintain the household and keep everybody on a path, especially right now with all the schools being closed with the coronavirus, kids being home, schedules being disrupted. It's chaos right now, and that adds to a level, the stress response syndrome that we're going to touch on here in a little bit, that can really exacerbate a lot of these symptoms that we see. Down to right now, our athletes, the gyms are closed, the training facilities are closed, and these are all, these are a big deal on people's patterns, their mind, their mental state, their mental health, and all the way down to the executives right now that never missed a day of work ever, and now they're being home for 2 or 3 weeks as everything is getting resolved. So we got a lot that's going on, and things are incredibly widespread. They're changing day to day, and this literally derails life, our fun, our fitness, productivity, sleep, energy, everything. And what's crazy is when it comes to the low back portion of this, a lot of this is preventable, and most of it is absolutely correctable. But to correct a problem, you need to understand the cause first. So let's take a closer look at back problems and how they tie into other parts of the body. Now here down in this slide, I'm showing a picture of the lower part of the back. That's the lumbar spine, is composed of 5 vertebrae, and then we have 5 discs that are in between each one of these vertebrae. This intervertebral disc is basically like a jello-filled water balloon, and it's composed of two basic parts: the nucleus pulposus, which is the jelly-filled center of the water balloon, and then the annual fibers, which are on the outside that represent the balloon part. Now, these annual fibers take a lot of stress, compression, twisting, and turning as we go through regular range of motion. The lumbar is critical in structural support. It protects the spinal cord, but also it helps with what we call the cerebrospinal fluid pump. And your sacrum, which is right down here in the bottom below the lumbar vertebrae, actually pumps a fluid called cerebrospinal fluid all the way through the spinal canal that surrounds the spinal cord and goes up into the ventricles of the brain. So this whole system, this cooling system, this protection system of cerebrospinal fluid goes from the brain and surrounds every part of the spinal cord as we go through. And the lumbar spine is a critical component to this pump because the most common herniated discs on the planet are right here at L5-S1 and L4-L5, that lower part of that spine, which blocks that pump. And as a result, it can lead to a lot of different body signals that we were just going through. So let's take a look a little bit closer at this disc herniation. Now, like I said, in the inner side, we have the nucleus pulposus, and that is the fluid center filling of a water balloon for this analogy. On the outside are these annual fibers. There are a bunch of rubber bands that tie these bones together and keep that fluid back. With a herniated disc, that fluid erupts or pushes through those annual fibers and starts impeding with the nerve flow or the spinal cord itself. Once we start seeing that, we go into a whole different part of response from the body. We get an efferent response from how the muscles are respond. They tighten up, and then we have your senses are perceived differently, and everything on how this nerve takes in or gives out information is altered as a result. So these spinal motor nerves play a huge role in not only motion, but also in your posture and understanding your position properly. So when we're dealing with something like sciatica, sciatica is a fancy name for an irritated sciatic nerve from the disc, the bone, or the muscles that is causing pain, numbness, and tingling to radiate away from the problem area down through the lower extremity or up into the spine. This is how we can properly identify the symptoms or the body signals of a herniated disc in sciatica. Take a look at this at lumbar x-ray. So here on the left, we have a normal lumbar vertebrae with well-defined borders, thick, big spaces that represent the disc in between the bones, and equal. In this next level, and the next one to the right, you can see where those bones have shifted, and as a result, the area between the bones have decreased. And here to the right in the MRI, you can actually see where that arrow is, where that disc material has erupted from the disc and is interfering with how the spinal cord and nervous system is flowing. So this is a herniated disc, aka a slipped disc. And the MRI is critical in being able to understand if you're a candidate for what we can do non-surgically to repair that, but also if it's a bone, nerve, disc, or muscle issue. So, these low back pain, the tight muscles, the lost range of motion, the leg pain, the burning, and the numbness, these add up over time and they get more and more significant. But what we're talking about is most of our 20-year-olds, they get an injury, they think they're young, they can keep moving, they keep doing what they're doing, and they push through it. Now by 30, 40, and 50, these injuries get more and more significant, and then as a result, they have more and more significant damage. Now, allopathic options when it comes to the degenerative low back and the body signals that are surrounding this are heat, bed rest, drugs, physical therapy, steroid injections, which, by the way, steroid injections, there isn't a single drug that's on the market that is recommended for shots into the spinal cord for disc injuries. It is an off-label use done by every single person that puts a shot into somebody's low back. It actually says on the box of the medication, not recommended for that. And if you guys want to see a great model on how this, the process of the steroid injections, go ahead and look up Dr. Oz on steroid injections, and they'll show you an awesome model on this for when it comes to spinal steroid injections. Pain management, more and more drugs, surgery. I mean, this is just a circle that once you get to the end, there's no way for people to actually have progress on this. This is just patching, and then drugging it out. So we need to find some alternatives in this. I mean, this is crazy. You know, you got to ask yourself, what is the goal? You know, what measures is what is a successful measure? You know, what are we trying to accomplish with this? And the idea is we're trying to accomplish movement. Movement is the key to life. If people are moving better, then we can get switched from a sick model to a health model. So we need to ask better questions so we can get better answers. The safety, the efficacy of treatment, the side effects, the short-term and long-term, reasonable expectations. And what I find with a lot of these surgeries and more, and the laser procedures, the steroid injections, is that expectations aren't managed properly between the surgeon and the patient. And what a surgeon considers a proper or a good procedure, aka did the parts go together well, versus a patient discussing how they feel and responded to treatment, are often two very different things. But unfortunately, once we start having surgery and injections, it really starts limiting our options and really starts decreasing the possibility for a more effective goal being reached, a long-term goal. So the first thing we need to know is how bad is this stuff? I mean, what's crazy when it comes to low back right now, 80% of Americans will experience back pain. 35% of them have low back pain at any given time. Incidence is up from 29% to 34% in the last 15 years. It's more common in females. A third of females suffer from low back pain. 31% of men report that it affects their work. Only 20% of females report that it affects their work. So we obviously know that females are tougher here. 54% of our low back pain sufferers are desk workers. They're sitting at a desk. I mean, sitting is literally the new smoking. And 50% of women experience back pain when they're pregnant. And I can certainly attest to this right now with my wife, who is scheduled to give birth during, or not scheduled, hopeful to give birth here in the next week through all this craziness that is going on. So it's and she has definitely been suffering from low back pain and other issues, and we use a lot of different things to keep things moving. We're Webster certified. We work on that area, work on the pelvic floor. We normalize the system because we recognize that when it comes to this type of pain, this has a huge industry effect. $50 billion lost in direct cost to low back pain. $100 billion lost in indirect issues dealing with back pain. That means like the life effect, the real story on how it affects life for all these different people. I mean, it's missing work, it's losing money, the productivity, the jobs, missing play, can't go out and enjoy all the hard work that you're doing, the fruits of your labor, and they stop doing these things that they love. They stop exercising, they stop living an active lifestyle and start going on this downward spiral, living around the problem and stop doing the things that they love. But then it can get much worse than that. Real pain and suffering, acute pain, then chronic issues, leads to drug use, you know, first popping over-the-counter stuff, and then leads into harder and more significant opioids. The prescription pain kills, then illegal street drugs when the pain management companies decide that they've given you too much. This is our nation's biggest health issue right now. I mean, up to this coronavirus issue that's going on, is that it's the pills, it's the opioids that have been used irresponsibly for years. And we've seen this. I mean, we've seen this on the news. We've seen it in our town now. A lot of the news is taken over with the current pandemic with the virus, but the underlying cause of a lot of people's issues are still there. You know, we have to get people off their drugs. We have to get people off their addictions. We have to get people moving better so they can start healing from the inside out. All right? The inside out. Now, let's take a look at this. Let's just talk about some of these drugs, the stats that I just threw at you. I threw a bunch of numbers out at you, but let's look at the increase in legal narcotic production, just the production, from 1993 to 2016. Look at how much oxycodone, morphine, hydrocodone has gone up. Now, we hear a lot about fentanyl and all the stuff that's coming from China and how a small portion of this can kill a country. All right, but these are drugs that are being produced at high levels at an exponential growth rate right now. It is literally the #1 selling drug class in America. Over statin drugs and anti-anxiety drugs. I mean, it is everywhere. Here's another map. Look at this. Opioid prescriptions per 100 people. All right, we have the red shows 128 to 143. Now, how do I have more drugs than the 100 that this is talking about? Because there's 2, 3, or 4 prescriptions on here. Look at this. I mean, these drugs just keep going and going, and we have to stop this downward slide. We're at a precipice right now where people are starting to recognize and starting to understand with all the information that you have to take care of your body. The answer isn't in a drug. It isn't in a pill. And it certainly isn't in a drug or a pill that's produced by China right now, where apparently a lot of our drugs are produced. There's a whole bunch of things that are happening that are going to switch day by day on how we dispense, receive, and educate people on healthcare. But let's call a spade on what's happening right here. We have a lot of drugs that are being out there. The United States has 7 to 8% of the global population, and we consume over 56% of the globe's drugs. But yet we're ranked one of the sickest countries overall. All right. Right now we're talking about this as 40 people die a day from a narcotic prescription overdose. Enough prescription painkillers were prescribed in 2010 to medicate every American adult around the clock for a month. That's almost 300 million people. All right. Think about the numbers that are involved with that. The logistics, overdose and deaths involving opioids, which include, by the way, cocaine and heroin and some other drugs, is crazy. I mean, you can see it from 1999 all the way up through 2010. I mean, this study is 10 years old. You think that this is getting better or worse from right now? I guarantee you it's getting worse with where we're going. So we have to stop this trend right now. I mean, look at this. Look at all the stories about there when it comes to back pain. This is a widely considered huge threat that our country faces. Okay? So hands up if you know that we have a health crisis other than the coronavirus right now. We have a drug culture, all right, instead of a healthcare system. People are taught that drugs are the first and best choice for managing your health. And if you have collected or invested any time into the news right now, there's a lot that's going on about this virus, and we're going to talk about it in just a moment, but it is a virus, which means that it does not respond to antibiotics. It also means that your body, that innate intelligence, has a system for this to go through and have an immune response by doing all the different body signals to burn this virus out. The healthier you are right now, the better your chances are of getting through this better. But unfortunately, when we're looking at a lot of these deaths, especially from Italy, 99% of the people that died from the coronavirus, or quote unquote the coronavirus in Italy over the past several weeks, have had a one or more chronic lung disease processes. So it's even more important now, and I'm hoping people are understanding this, because we don't have a lot of time when it comes to respond virally. And the best way to do that is to make sure that your body is the strongest that it possibly can be. Germs and viruses are not seeds that proliferate into a disease. They only grow if the soil is sufficient for them to grow. And by the soil, people, I mean your body. So there's one of my little tidbits on corona. But right now, when it comes into the low back pain, I mean, there are tons of highly addictive, highly strong, pain-numbing, life-numbing, mind-numbing drugs that not only take the pain away from you, but they take away your life, and they take away your ability to interact, react, and move. All right, we have a drug culture. For every problem, there's a pill. For every pain, a drug. And the cycle just keeps going. You know, this does not end well, and we need to come up with a better way. All right, the heat, the bed rest, the drugs, the physical therapy, all these other things. Like, if your premise is wrong, your approach is wrong. So what we got to talk about, heat is inflammation. Bed rest is lack of movement. Drugs is putting chemistry into an environment that's already in haywire and can upregulate and downregulate things severely without any pre-warning. Physical therapy is excellent for treating soft tissue and surrounding the problem, but the problem must be addressed first. Steroids, dangerous, powerful anti-inflammatories with long-term joint damage. Pain management, I mean, I've worked with these guys for years, and these pain management clinics feel that you should not be in pain, so they'll continue to elevate your levels of drugs to keep that pain under wrap. All right, and then there's surgery. When all else fails, they throw you under surgery, and that's when we start to give up. All right, now when we're talking surgery, when you go into this, you know, they're screwing things together, they're putting hardware in there, and you don't know what you're walking out with until after it's done. I mean, we can have infections, we can have nerve damage, we can have permanent disability. They are literally going through, on a surgery like this, 3 or 4 inches of muscle, tissue, skin, fat, and spine, and trying to lodge things in between a dynamic, movable joint, and hopeful that a static rod, screws, pins will help maintain stability. But what I can tell you is that a lot of times these surgeries don't work. We don't know. We have infections. There's other problems. There's instabilities. There's muscles that don't work. On worst case, paralysis, incontinence, and then having to go in and do these surgeries over and over and over again. Does this look like a good option to you guys? I hope not. I hope not. So we need to ask some better questions so we can get a better result. You know, what are the risks of this procedure? We talked about it. Infections, nerve damage, permanent disability. The costs of this, I mean, the cost for a laminectomy are up to $90,000. And the expected out, and that doesn't include the therapy and stuff afterwards. You know, what are the outcomes? What is it, you know, you do the surgery, what happens as a result? You know, can we ask 10 different patients of the results to see how they're feeling? Is there any recent research that shows a response? You know, what are my other options moving forward? And is this treating my symptoms, or is it correcting the cause of the problem, which is where we always want to go? All right, prescription medications, you know, pain sufferers rated these treatments. And, you know, how about cost effectiveness, adverse outcome risks, as well as addiction issues? You know, chiropractic treatment without drugs, without surgery, has a 54% success rate, higher than physical therapy, and right below the prescription drugs with 0 negative side effects. Enough said. All right. Get rid of these low back pain, tight muscles, reduced range of motion. Get rid of these body signals. This is your body communicating, and it's begging for mercy. It's begging for you to stop doing something that is hurting you, or to start doing something that is good for you, and you have not been doing it. All right, that's where a lot of people are getting sick. They have not been doing healthy. Sometimes the body whispers, and sometimes it screams, and then sometimes it just kicks you in the butt. All right. So the next, we're going to look at the ceiling. We're going to grasp, you know, we have to get some motion in here. So you need to look up, look down, turn around, look to the left, look to the right. You know, has anyone in here ever had that moment or that 1 second where you're fine, then you decide to pick up a wet towel off the bathroom floor or your car keys, or pick up a pencil or the mattress that just needs to be flipped. And then that next second, you're looking at the ceiling, grasping your low back. All right. We need to avoid that crisis. And the only way you avoid that crisis is recognizing and taking responsibility for what's going on. These body signals, these body symptoms that have been screaming to you are literally just the tip of the iceberg. The real problem is down, it's mechanical, and it needs to be addressed. So what we're going to talk about right now is this illness wellness continuum and how it ties into your low back and how it ties into your immune system. All right, so I love this slide because right here it shows that there is a continuum. On one side, we have premature death with disability, symptoms, and signs. And then we switch to the other side of the wellness paradigm to awareness, education, growth, and these high-level wellness. So on one side, we have the beautiful, healthy, smart version of yourself. And on the other side, on the left side, we have the ugly, sick, and stupid version of yourself. So what I can tell you right now is that anybody that's listening to my voice is somewhere on the spectrum. And not only are they on the spectrum, they're heading in one direction or the other. And not only are they on the spectrum heading in this direction one way or another, they are doing it with a certain speed, which builds up momentum and velocity and momentum one way or the other. Unfortunately, all these people that we talked about the coronavirus, that have had these chronic, where's my research right here? We have from diabetes, heart disease, immune issues. I mean, there's a whole bunch of things that lower your body's ability to fight. The foods we eat, the smoke, the cigarettes, the vaping, the stress levels change our hormones. And as a result, it takes longer, especially if we're in a stressed out situation, if we're getting to that signs and symptoms of what's going on, to switch that back to the awareness, education, growth problem. All right. So we need to make sure that we don't think about the way you think about a symptom to drive your choices, which helps drive your outcomes. We want to get to that high level of awareness, education, knowledge. And as a result, we get to make people smarter, stronger, and then all of a sudden people aren't getting sick. So if you want to catch the coronavirus, this is how you do it. You eat a poor diet, all right? So you start, making sure your body lacks the vitamins and minerals and enzymes and the micronutrients needed to keep itself in good repair. You avoid adequate rest. Stay up late, use tobacco, sugar, coffee, watch the news nonstop, and drink all those energy drinks. Become dehydrated. Drink more sodas, all that carbonated stuff. Reduce the effectiveness of your natural defense mechanisms by eliminating adequate water supplies. Another great way to catch a coronavirus is to stop exercising. Now, the gyms are closed right now, which is why I'm actually teaming up with a couple of the trainers and some food sources to get you guys some exercises inside. So we're going to respond to this video, and I will send you some information for some of our trainers, as well as some food sources on how we can increase our social distance responsibility. You want to catch the coronavirus? Keep watching the news. Think about all these negative vibes and the fear mongering and all these ridiculous stories that aren't verified, that aren't studied, that aren't backed up, and just keep weaving into this fear-based problem advancing this pandemic. Don't wash your hands. Use your hand, don't wash them. Touch everything, put them in your hands, put them in your mouth, put them in your eyes, and then most importantly, stop getting your chiropractic adjustments, stop getting your health treatment, stop doing your laser, stop doing those things that you've been actively doing to maintain your body. And I promise you that if you do all of these things, that you will become a hospitable host and just ready for all those coronaviruses to grow on you. Now, I hope to my crowd that's out there that's listening understands that I'm being very sarcastic. I don't want anybody to catch the coronavirus. But I do want you to understand and to recognize that most of us are not working. We're at home. We're trying to do some of our work on a less than efficient ergonomic space. Our kids are home. We're stressed out. We're not sleeping. We are literally creating, the gyms are closed. There's tons of negative information out there. We have created an environment that is hospitable for this virus. And the only way to get rid of it is to make your body better. And the first part about making your body better is to understanding that there's a difference between feeling versus function. Only 10% of our nerves sense pain, sense problems. Everything else, the motor nerves, the movement, the autonomic nerves, with our blood vessels, our immune system, our gastrointestinal, our reproductive, all of that is controlled subconsciously. And if we are stressed out, it affects us and leads us into a stress response syndrome. But this system, the master system, your nerves, your brain, your spinal cord, is so important. This nerve supply is so important that it's completely protected by all 24 vertebrae, the different discs, the muscles, the tissues. I mean, there are 8 bones that make up your skull. That's a helmet that surrounds and protects your brain. The spinal column is that suit of armor that protects the spinal cord. If it stays healthy, communication is optimal, health is optimal. Your body talks to your brain, tells it what it needs, tells it how to adapt. Your brain listens and responds, just like how we're doing right now with the virus and all the other issues. It tells the body what to do. Now, this is how you stay healthy. This is how you function. This is how you heal. What happens when communication breaks down in a company, in a factory, in our country, is that it leads to everything getting worse. Communication is everything. Your nervous system is a communication network for your body. If you want a healthy body, then you need a healthy nervous system. That's why all those bones are there. They're protecting something vital. If you want a healthy nervous system, you need to protect your spine. All right? Imagine what happens to all those delicate nerves that we see connecting to these body parts when there's swelling from tissue damage in the spinal joints, when there's a disc herniation or a slipped disc or metastatic cancer in those bones. All right? Your body is smart and it's telling you to stop doing what you're doing and start doing some other stuff. All right? With a subluxation, these pain fibers in the nerves get aggravated, and as a result, this adaptive stress response physiology starts. Our blood pressure changes, our heart rate goes up, the muscle tone goes up, our digestion gets messed up, the reproduction sex drive drops, our serotonin levels drop, which means we're not sleeping. That increased sensory system for that. The protection mode, which means we get too much information coming in, which leads into fear and anxiety. And then that lowers your immune response. It lowers the insulin sensitivity, and it makes that sugar going in your body a prime spot for these viruses to eat up. So that blood sugar goes up. You decrease your HDL, the LDLs go up. And this is always a result of trying to create more hormones to cope with the stress to help with the repair. And then last but not least, it'll lead to clotting factors, which is the reason why our heart disease goes up with heart attacks. So the premise has to change. You need to understand that healthy is normal, okay? I want everybody to understand that your body is super smart. Healthy is normal right now, okay? Your body is super smart. The nervous system is that master system, but your spine is your suit of armor, and you need to protect it. And right now, especially right now, without the kids being in school, with our entire pattern and life being turned upside down, with the hysteria that's surrounding coronavirus, modern life is just unnaturally stressful. All right? And these sources of stress come from thoughts, from toxins, from traumas. And this stress level will lead into macro trauma, like a car accident, to shoveling and leaf raking, to these micro traumas, where we're always at a computer, or the little laptops at the kitchen table right now without the nice chair. I mean, everybody's been working on an ergonomic workstation at their work. But in light of what's happened recently, your workstations suck. We're not getting the food that we need. Our gyms are closed. Most of us use those as an excuse to not be moving. And as a result, the stress levels are going up because the kids are in there and they're doing more and more stuff. They're not on their pattern. And this cycle will just build. It'll just build and build and build until eventually we have burnout. And that burnout will lead to a subluxation with joint misalignment, with tissue damage, with disc damage, with inflammation, with muscle spasms, lost motion, and pain throughout this level. This is called a movement deficiency syndrome. And this will become our next pandemic with what's going on with Corona. This stress response syndrome has been elevated exponentially in the last couple weeks, and it is getting, each day this information is changing with what's going on. It affects where we're working, which affects our low back, which affects our solutions, and as a result we need to call it what it is and start taking responsibility for what we need to do. All right, because remember, it's not what we can feel, it's what functions. So the best way to figure out if there's nerve interference, sorry about the typo here, is you got to get it checked. You got to go through motion. You got to go through procedures. You got to go through instrumentation, posture, x-rays, nerve scans to evaluate the level of that nervous system and to evaluate the level of communication in the nervous system. The better the communication, the better the immune response is, the better the healing response is. The more problems, the more disc issues, the more pressure or abnormal nerve interference, the less your body's going to be able to respond, which means that we just created an environment that can grow pain and the disease. So there's some things we need to stop doing. There's some things we need to slow down, and there's some things that we need to start doing. All right. This three-legged stool approach is one of my favorite analogies because in order, the things that we need to keep doing is you got to keep your adjustments and your treatments in a regular rhythm. Every pattern has been disrupted right now with our lives. You have to maintain some stability in that. So maintain the schedules as best as you can. We have to break some bad habits, and we definitely have to eliminate bad habits before they start. So watch your eating habits, and the best way to do this right now and stay out of the grocery stores and make sure that there's less people touching your food, or if they are touching your food, it's highly regulated, as I'm putting a shout out to my boys over at Mighty Meals. I want you guys to all take a look at www.eatmightymeals.com. These guys have been putting together a food prep service for the last several years, and I've just got to see their business flourish. They're doing great things throughout the Northern Virginia area and DC, and we are so fortunate to have a company that believes in non-hormone, grass-fed, good meat, supporting local businesses and local farmers. They prep this food every day. They are FDA approved. They're in a clean environment to be doing this. Everybody is being tested as they go through this process, and they have a delivery system to bring it right to your door. So not only are we getting good food, we're eliminating our exposure outside, we're supporting local business, and we're supporting our farmers here, and we're getting good nutrient-rich food. Need I say any more? If you want to break bad habits, prepare for the good ones. Go check out eatmightymeals.com. Load up on this food. They deliver several times a week now, and there's opportunities for you to donate meals to our first responders. And you want to talk about a good opportunity to come together and to really reap the benefit of some of the great entrepreneurs and businesses around here. You got to start with the fuel that fires everything. Now, for our workouts, I'm going to put a shout out to my buddy Nick Graziano. I'm going to get his Facebook page up here and his Instagram, but he's doing a series of exercises for our crew and some of his patients and some of his clients on how to do your workouts at home through all difficulty levels. So if you want those information or want personal invites to these guys, and I highly recommend you reach out to them, drop my name, say Disc Centers of America, reach out to us, and I will make sure that you get all their information and get to reap the benefits of these guys' years of their knowledge and years of expertise. So I hope that with what we're talking here with the three-legged stool approach, you guys understand what I'm talking about, man. Stay in a rhythm, fix the problem, strengthen the area so we can build up resistance, and then eliminate the problems that keep causing issues. This is how we get fixed. All the stuff with the coronavirus, here's some things I want everybody to take home with. It is a virus. It does not respond to antibiotics, so don't get on that conversation. All right? You need to wash your hands. You need to try to eliminate your contact with some people. It's why the grocery store is, you know, the carts, the food, reach out to these guys at Mighty Meals. They help eliminate just that part, not to mention the prep and the sources, because right now grocery stores are picked clean. And we got to get you back to exercising. So we're going to put some stuff together with Grass Fitness, and we're going to show you guys how to move right at home. So you can move right, eat right, and think right. And all of this plays a role in how people are affecting with their low back. Their workstations aren't good. Their ergonomics are bad. Their food sources are bad. These are everything that we talked about on how to get the coronavirus. So I hope that I was able to drop some knowledge on you guys. I have more and more stats that I want to do with the coronavirus and with some things that we can do to fight it moving forward. So I'm going to do a part 2 to this workshop, and we're going to release this out on Facebook this weekend, where we're going to go over the stats, the FDA, the updates, everything with this COVID-19, and show you guys that how to calm the mind a little bit, reduce those hormones, and get the body into that heal, grow, repair phase. With that being said, I love and appreciate everybody for tuning in tonight. Wish my wife luck. She is, we're at almost 39 weeks pregnant right now, and this is definitely a stressful time for everybody. And bringing a baby into the hospital with all these rules right now, it's stressful for everybody. So this is as therapeutic for me to vent some of my thoughts out here for everybody, and I just appreciate and love that I say something that people want to listen to. So whether you like it or you think it's valuable, please like, share, comment. If there's any information you want that I haven't gone over with the Bulletproof Your Low Back or with the COVID with the second part, please reach out to us, and I will do everything I can to get it out to you guys. So to everybody that's out there, stay well, be well. Check out Grass Fitness. Check out eatmightymeals.com. And I'm going to bring some real stats and some real information about what's going on up to date this weekend, so that we can hopefully eliminate some of the stress and fear behind COVID-19. This is Dr. Nicholas Morrow from Disc Centers of America, loving and appreciating everybody. Thank you and good night.